Hey everyone, it's Mike Jones, president of the Medical Exercise Training Institute, and thank you for taking the time to learn more about our Medical Exercise Program Director Training Series, as well as certification. We started this back in 1999, and we started it because we realized many of our medical exercise specialists were coming to us 5 years after the Medical Exercise Specialist program started. They were coming to us asking us, Dr. Mike, I've now been tasked with managing a medical exercise or a post-rehab program in my facility. Whether it was a large box gym, it was a physical therapy or chiropractic setting or a sports medicine clinic, or maybe even a hospital-based program, they were now tasked with being the director of this facility. And with that, we put together our MEPD program to allow them now to administrate, manage, develop, promote the program, but also be the liaison between the medical exercise or post-rehab program and the medical community. Well, now, folks, 25 years later, we need MEPDs even more. When we started back in 1994 with the medical exercise specialists, it was just kind of a goofy idea. Well, it's caught on, and now we have MESs on 6 continents around the world. But more importantly, the medical community has now embraced the idea of medical exercise training. Clients have embraced it, and even insurance carriers have embraced it, which means we need more medical exercise program directors or MEPDs. So if you got a moment, let me tell you a little bit about the program. As I said, we've been around now for 25 years, and the program is broken down into 3 components. We have our clinical modules, our MedFit assessment modules, and our medical exercise systems modules. Let me tell you a little bit more about each one. Our clinical modules are actually designed to give you a better understanding of the various aspects of medical exercise science and how they'll impact your client. So you'll notice here we have a segment, we'll talk about pharmacology, we'll talk about ergonomics, even senior fitness, and we'll also have 3 segments that will look at advanced guidelines for the knee, shoulder, and spine. And in those, we'll even do some cadaver dissections to give you a better understanding of clinical anatomy. The MedFit assessment series is just that. We'll dive deep into the medical exercise assessment for the major regions of the body, the major joints of the body. Folks, the fitness assessments that you did when you were doing personal training are not adequate now for the medical exercise training client, nor are they adequate for the information that you now must communicate to the physician, the therapist, the chiropractor, and also even to the insurance carrier. So these modules are essential for the program. And then our last set of modules are the medical exercise training systems modules. Folks, the one thing that you'll learn is personal training and medical exercise training are 2 different beasts. They're completely different. With medical exercise training, it requires a lot more detail, a lot more documentation, and a lot more communication. And in these segments, we're going to go over how you set up systems in your practice so that now you can communicate effectively with the medical community. You can document everything effectively, but also you'll put systems in place from operations to documentation, communication systems, staffing systems, marketing systems, so that now you can effectively run the practice. Folks, a medical exercise training or post-rehab practice is not a personal training practice. They're completely different. So with that, our MEPD program is now up and running. We've made some changes to it now, and you can do the entire program online. We used to have live segments. Now you can do the entire program online because we realize you guys are busy out there. You're seeing these clients because the need for medical exercise training has grown. So you got a lot more clients and you need a lot more time to work on the program. So we made it all online. So you'll have access to the 3 components, the clinical modules, the MedFit assessment modules, the medical exercise training systems modules, but you'll also be asked after you complete those and the quizzes that go along with them, you'll be asked to do one additional project, which is to come up with a topic, a medical exercise or post-rehab related topic, develop a PowerPoint presentation, and then make that presentation to a group of your peers, personal trainers, medical exercise professionals, or even medical professionals. But you have to record yourself doing it. I said, well, Dr. Mike, whoa, wait a minute. I got to record myself and I have to make this presentation. Folks, as the medical exercise program director, you're going to have to talk to physicians, therapists, chiropractors, clients. You may have to go out and do outreach programs. So guess what? As an MEPD, you need to get used to the idea of going out there and presenting. So that's one of the projects, as well as completing all the modules. So with that, please, if you would, go over to medicalexerciseprogramdirector.com to get more information. Or if you're on our page, look down below and get registered. We need MEPDs around the world, not just here in the United States or in North America. We need them around the world because the need for medical exercise training is growing, folks. You'll see on our website, postrehab.com, we've got some statistics there that tell you the number of individuals that need ongoing exercise after physical therapy is done is staggering. We need someone to manage, develop, administer these programs, as well as liaison between the medical community and the medical exercise training program. So please go over to medicalexerciseprogramdirector.com. If you're on the page, register down below, and we look forward to having you as part of our program.